Thank you for the clarification on that. And you mentioned earlier about 18 different services or solutions that are typically used in a hospital setting. Can you give us insight about what are the tools or equipment or devices that are used in home? Where are you getting these? Are these third-party companies? These something that you built yourself? Where does this come from, and what are they? What are those? Can you give us an example of some of those 18 services?
Sure. So we're all, the founders are all engineers, so we're a bunch of geeks. So we geeked our way in the beginning, and I'll tell you a wonderful story how we geeked our way into this, because it is a good story. So I have some colleagues from WellPoint, which is now Anthem, and I said before I started this crazy journey, I knew it was going to be a very long journey. I want you to take a whiteboard and tell me how much of the savings we're going to create you're going to want to keep, because I could go through all this effort through all these years, and then in the end, there's not enough malted for the three straws in the malted, meaning us, our customer, and the payer. There had to be enough pie in the pie pan. So I needed to understand that first. And I went through a pretty significant amount of diligence through the lens of a payer of what kind of economic benefit they would have to enable this model, not stop it, in other words. So that was a big part of how I began. Then, because of the diligence we did on every single service in the hospital and then the equivalent in the community, I knew exactly how much it would cost to care for a pneumonia patient that was level 3. How much oxygen, how many visits, how many x-rays. I knew exactly what it would cost. So let's just make up a number. Let's call it $5,000. I also knew that the number of times our command center would have to talk to the patient and how many times the patient and the family would call us. And let's call that $2,000. Just make up a number. So now I'm $5,000 and $2,000 in terms of cost. I also knew how much payer savings they had to keep, and I knew how much the customer wanted. I also knew how much profit margin we have to be sustainable and have a return on investment for our investors. That left $13.75 a day for the tech in the home. So I didn't start falling in love with technology, even though I'm a geek. I fell in love with $13.75 a day, and times 30 days, you just basically have about $500 to spend, roughly. So what could I do for $500? I knew I had to manage their vitals, so I looked at every blood pressure cuff, every pulse oximeter, every patch, cardiac patch, looked at every scale, looked at every router, I looked at everything. Backup power, battery power. How many days? 3 days, 6 days, 9 days. How much backup signal? 1 backup signal, 2 backup signals. So as you go through what you could do with $13.75 a day, and then you walk into what you have to do to keep the patient safe, and you find the balance, and then you drive on the technology and on the service to make it reliable, make it safe. So the tech in the home is a series of vitals monitoring. It's all third party, although we did take a scale and we modified it because some patients with COPD have challenges with their weight, and when they step on the scale, the reading is sometimes inaccurate at home. So we built basically a guardrail where the patient could stand on the rail, which doesn't affect the accuracy of their weight. We attached a Bluetooth device. We actually modified an existing scale so it's much more friendly and user-friendly for patients. But other than that, everything is third party. It changes frequently because the technology improves all the time, particularly vitals monitoring. But in the home, we have vitals monitoring, all the major vitals that we need to monitor, both real-time and intermittent, backup power, backup cell signal, durable medical equipment, whatever the patient needs. If they need a bed, we provide that. Whatever they need, we provide it. Supplies, backup medication, anything and everything they need to enable the home is kitted and provided at the time they're admitted into their home, which is done in less than 40 minutes.
Wow. Impressive. Really impressive. And this kit that you're talking about, is it one standard kit for everybody, or is it also, do you pick and replace different products depending on the different types of patients?
It's a base kit, and then obviously as the patient has specific and unique needs, we'll augment it appropriately.
Gotcha.
But everybody gets the technology in the home, and the degree of modification depends on a number of factors, particularly it might relate to their home.